Congratulations, you're turning 65 and looking at Medicare options and trying to decide on your own what you should do. Are you taking the common sense approach to this? Probably not. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, if you're like most folks turning 65, you're going to be looking for information on the internet. You're probably not going to understand most of it. You're not sure you're even asking the right questions. You're asking friends, you're going to seminars and all that kind of stuff. Plus, you're probably inviting a bunch of strangers into your home. That would be the insurance agents to come in there and try and sell you something you don't want, you don't need, and you can't afford. Rather than doing that, why don't you try this? Start by asking your doctor or doctors what they think would be best for you. After all, they're the ones that are going to be treating you. They're the ones that are going to have to deal with the hassles and denials and delays and everything else from insurance companies. Why don't you ask your doctor what they think would be right for you based on your current and future health? That's one thing. Talk to your doctor. The other thing is, and you'll never hear this from any insurance agent but me, the other thing is, talk to people you know who are on Medicare and have been sick or are sick now. I mean, after all, health insurance isn't any good if it doesn't pay your claims. So you really need to get a perspective from somebody who's actually used their plan, not somebody that says, "Oh, I'm completely healthy and never go to the doctor, and it doesn't cost me anything, and so it's the greatest thing in the world." No, you want to talk to people who are sick. They're in a position to tell you, well, this is the plan I've got, and this is great, or this is the worst thing in the world. I wish I hadn't done this. So talk to people you know who are on Medicare and have had health issues. Do those two things, talk to your doctor and talk to people on Medicare who have been sick. Now, there's actually a third thing I'm going to suggest. Rather than spending all this time going to seminars, looking on the web, and getting even more confused than ever, give me a call. Spend 10 minutes. Take 10 minutes out of your day. Ask me any question you want about Medicare. At the end of 10 minutes, if you have more questions, I'll stay on the line as long as possible. On the other hand, if you feel like this is a waste of your time, we're not getting anywhere, I don't know what I'm doing, any of the above, then we hang up and part as friends. But I will spend as much time on the phone with you as possible and answer your questions. And I will never give you a sales pitch. I'm not going to ask to come to your home. Everything we do is by phone and email. I mean, how easy is that? This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.